we're starting.
We're starting again?
Yeah, we're starting again, and it'll take a second to start doing all the things.
Do you think anybody's going to be on?
They'll probably just be refreshing or clicking through it. And then
I've gotten a few text messages of like, I can't hear you. Like, I know.
Okay.
They said, good luck.
I think we're live, Olivia.
Yeah.
Well, thank you. Are you coming
maybe.
back?
We're back.
We're back. We're here. I think we're here.
Yeah, text everyone.
Text everyone. Text your friends.
Refresh.
Everyone refresh.
Refresh. I think we're here. Are you?
You said it was going to be a casual day, and it's a little too casual.
A little too casual.
A little too casual.
A little too cash today. I think we're back, though. And I've now given 2 beautiful introductions that no one's heard.
So let's just dive in. What are we talking about today?
Well, that's kind of part of the introduction. So you guys, again, welcome to, for the third time, welcome to Medicare Cafe.
Third time's the charm.
We're going to see. You're joined by your host. My name's Olivia Richardson.
And I'm Kari Vogt.
And you guys may not recognize us because we have been pretty MIA.
Long time.
A long time. And so we just want to, honestly, what today's episode is a casual episode in every which way. And we're going to be just basically give you an update of like what we're working on. Where have we been? Where are we going? What's happening? And so before I turn over to Kari to kind of give me, your life updates of what's been keeping you busy these last month. I wanted to give a quick thank you to the Medicare Cafe team for really picking up and taking over while we have been out. So Sadie, who is our producer, she's sitting here right now texting furiously saying thank you. Everything is good.
I have my noise canceling.
You're good. Okay. You're good. So thank you to Sadie. She absolutely was hosting a lot of the episodes. Ben was on an episode from the cafe. And then we also brought in Chaylin Jackson, who is just like a Medicare whisperer. Just a guru, just as one of the best out there.
Guru.
Exactly. And just can make it simplify for somebody like me that's like.
Can you imagine reading the things he reads?
He does for fun. It's wild. It's
wild.
wild.
I'm glad people like him exist.
People like him have to exist.
Yes.
And for the simple fact of just like, I know this affects me. It affects my lifestyle, affects my wallet. Everything that you're talking about affects my day to day. I don't want to know about it unless it's you telling me.
Yeah. It's like accountants who like read the tax code. I'm like, what?
Why? Like, I'm glad someone does.
Yeah.
Couldn't be me.
Couldn't be.
So you'll be seeing a lot more of Chaylin throughout the year just because this is another, if you thought 2024 was the year of change, 2025 is equally going to be as tumultuous. That's the first time I've ever said that correctly. So it's going to be awesome. We're going to have, but I do have some updates as far as like SMS and how we fared in 2024.
Share, please
But before I get into that, Kari, how are you? I miss you.
Oh.
I just like, how are you?
I'm good. I was traveling. I was visiting my sister in Texas. She had a surgery, so I was helping her recover. So I had a nice, that was the first 4 days I have taken off of work. And usually I still am checking emails.
Yeah, of course.
My laptop, but I actually detached, which was good. I told myself I wanted to do that.
How is that? You have an assistant,
Yes.
right? So what is her responsibility when you are truly unplugged?
Everything
everything.
I mean,
okay.
She knows to call me if there's an emergency, of course. But if I see a call coming in, I just forward it. I just forward it straight to her.
Really?
I mean, she does. Yeah. I mean, she just does it all.
Yeah.
And she knows that if she can't handle something, she'll call me.
She'll just call you.
Yeah.
Perfect. Okay. What else were you doing?
Speaking of taxes, I've been doing my taxes.
God, what's your spreadsheets look? I know you have just some dirty spreadsheets.
I do.
Oh my God. Okay.
I do. And I'm changing from an LLC to an S Corp. So that's been
good for
exciting.
You. What was the big decision in that?
Just when you hit a certain income level, you save more in taxes by switching to an S Corp.
Okay.
So that, and just I get every little expense, I can, and just getting all organized. So that takes a while.
So you kind of hit that threshold, or it's worth the time and effort to do that. Okay.
Yes, for sure.
Very exciting.
So I've been doing taxes, and I've been weirdly busy. I've been really busy with
what's
yesterday.
Going on with
Yesterday I had a record. I had 7 meetings and got 5 new Medicare clients in one day yesterday.
What?
Yes.
Okay, what were your meetings? Just like appointments or like meetings like with networking partners?
No, they were like T65
And you got
meetings.
5 new clients
I got
in
5
one day.
new clients in one day.
That's insane. How did
It
those
was
clients
like
find
AEP.
you? MedSup or MA?
All med subs.
All med subs.
4 of them were financial advisor referrals,
Yeah.
and one of them was a client referral of a couple who just moved here from New York.
Oh, very cool. Did
Yeah.
they have an accent? I don't know.
They
how to do-
didn't.
Oh, Boston?
They really didn't.
That's upsetting. I'm upset.
Yeah,
I
they
really,
were.
a
They
lot
were
of my
very
happiness is
non-New
riding on that.
Yorkers.
Really? Oh, so they were nice.
Yeah, they were nice.
That's my favorite
They
thing.
were
when I
nice.
when I meet somebody from the East Coast, like New York, New
Uh-huh.
Jersey, Rhode Island, and like I'll talk to them, and then they'll come out with them like, yeah, no, you're too nice.
Well,
You're far too nice.
they've been summering down here,
Who summers in Missouri?
right? So they've been doing that for like 20 years. So they like
At the Ozarks or where?
in Columbia.
Who summers in Columbia? We have
They
the
have
worst
their
summers.
daughters here
Okay, fine.
and grandkids. So
Well, so that's
Yeah.
exciting. Tell me about your OEP right now. Like, tell me, like, I can tell you what the industry's seeing in OEP. What are you seeing during OEP?
it has been my biggest OEP simply because of the network issue with the university.
There's so many network issues happening right now, and a
Yes.
lot of them are getting resolved. So if I can just touch on that. Network issues lately have been really loud. They were loud going into AEP, and they were even louder during OEP.
Yep.
And we're actually seeing, in the past, when we've seen these really loud network changes, meaning like, hey, this network is us as a provider, us as a hospital is no
Yeah.
longer accepting this carrier.
Yep.
We've seen that in the past, and what that usually is just like a negotiation tactic.
Mm-hmm.
We're going to threaten you and let all of our patients know that they can no longer see us with your insurance, so that they leave your agent, so that we can negotiate better
Right,
pricing
right.
and better deals.
And then they get it figured out
And then
last
they get
minute.
it figured out last minute,
Yeah.
right? That's been continuing, but I'm seeing it being like, you can tell that healthcare right now and that insurance and the financial sides of things
Yeah.
are stressed because
Yeah.
they're louder than ever, and we're seeing deals not actually
For
get
sure.
done.
Yes.
We're in the past, it's like, yeah, they'll figure it out. They'll figure it out. We can do this. We're seeing deals not get made.
Yeah.
And I've not really been used to that in the past.
That Anthem. So I have spent time reaching out to all my Anthem MA clients and also my Anthem MedSup clients, because 90% of them are also confused because they hear, oh, Anthem's not accepted at MU. Anthem's not accepted at
Yes.
MU. And they're like, oh, no, I can't go to MU anymore. I'm like, no. Your supplement is fine.
Yeah.
Because I've had a ton of
So
Anthem supplement
much.
people thinking they have to switch.
Well, of course they would. They see Anthem and
Right.
it's all over the news. It's
So I've been
everywhere.
trying to get ahead of that and call my Anthem people, Anthem supplements. And what's interesting is like all of our agents, we've seen it's more people are sticking with the Anthem and leaving the provider
Yeah.
because the Anthem plan was one of the only ones that didn't have a prescription drug deductible.
Really?
Yes.
That's a shift. It used to be like, I think like the baby boomer, you can kind of have a split of that demographic of like an older generation or the older baby boomers
Right.
are so like, that's my doctor. I've seen them
Yeah.
for 50 years.
And
I'm
there's
not
still
going
those
elsewhere.
people.
Right.
But the majority, like when we've looked at our team numbers, more people are sticking with the plan due to
because of drug
they don't want to
costs.
have to meet the drug cost deductible.
Yeah.
And I think like just the mindset of it's 9 months. Like if it doesn't work well at a different provider, we can switch during AEP.
Okay,
Like
so,
I
like,
feel
there
like
is still
people are
some
more used to
flexibility.
maybe the ebbs and flows of the enrollment windows now, so it's not as like I don't know. I just feel like I'm gathering that from people.
That's really interesting because, again, seeing what people, knowing that the dynamics are shifting. It used to be really heavy med sub. Now we're seeing Medicare Advantage making almost 70%. Is the last
it
stat
70?
That's the last stat I heard. I don't know where they got it.
No.
The last stat that I saw personally was about 54%. But someone out
I
there
thought it was around
threw
54.
around 70. And just knowing that,
Wow.
like, again, people are becoming more educated about it, becoming more
Yeah.
familiar about it. So, like, it used to be Medicare Advantage plan. You have no flexibility. It's
Uh-huh.
interesting now that they're seeing the annual contract being a pro. And
Yeah.
like kind of equating to, well, if it doesn't work out, we can change
Right,
later.
we can change.
Like I've never heard Medicare Advantage plan, one, the annual contract be a pro, and two, think of it as a flexible advantage.
Yeah. Right. All
Wild.
of that was just like, it's just been different.
Yeah. So weird. So interesting. Okay. So when we're looking again like OEP across the board, we do think, I mean, we're seeing a ton of change. A lot of them, they're talking about the provider changes. OEP is going crazy. A lot of it, again, drug costs. They're not, the drugs and their prescriptions on an MA plan are not working the way they saw at the pharmacy, the way they
Yep.
thought they should be. And in fact, again, Deft Research, I talk about them every chance I get because
Yeah, they've got some
it's so
good
impressive.
numbers.
But they're finding that this OEP, especially, I'm doing this, sorry for my listeners. This OEP, especially, people are less and less satisfied with their Medicare Advantage plans.
That was the other thing is I've used OEP more because people made a change during AEP and have had all kinds of issues
Yeah.
with prior authorizations. And so they have been switching back.
Yeah, we're seeing a lot of people who are on these smaller regional plans. A lot of their smaller regional plans, I'll pick on Devoted being one of them, Essence being another one, lost membership this last AEP.
Really?
Lost a lot of membership. However, they're seeing huge OEPs, what they're calling win-backs, of people who were who were using the plan. They got distracted by all the other benefits. Like a lot of them went down in benefits. The people who are on these smaller regional plans are seeing pretty significantly large win-back numbers.
Interesting.
Because whenever people actually go and use the policy,
They're not as happy with it.
They're not as happy with it.
Yeah.
So, and the reason,
Interesting.
like, I think something we talk about, like, with these regional carriers, again, I'll pick on Devoted, I'll pick on Essence. Their big reason why you should write me is our customer service and
Yep.
how we take care of our
Oh, yeah.
patients,
There's
right?
totally something to be said for that.
And there is, but that's not the sexy benefit that people talk
Right.
about. That's not like, and I mean, like, I talk about sex insurance being
Yeah.
sexy. That's not like the thing that people, you're not going to gain membership. I'll say it like that. You're not going to gain membership off of, we take care of our people, even though it is true.
It's so true.
Their help centers are stateside. They help people all the way through. They have the best stories because they're smaller and they can be more flexible, can make those adjustments to help the consumers. But
Right.
that's not what gains membership.
Yeah.
So when we see OEP happens and a lot of these smaller plans suffered this year and lost membership, when people actually start using the benefits, they run
They're having
right back
win-backs.
to those regional plans
I'm not
because of that
surprised.
customer service. So something to think about. It's just kind of what we're seeing as a trend.
Yeah.
We're still seeing, again, like UHC 1, this past AEP, we're continuing to see a lot of that. And then a lot of people are using this time to really study up on chronic plans because the amount of energy, resources, time, effort is going into chronic condition plans to kind of make up for the lack of DSNP.
This is a
sales we're gonna
total
see.
derail comment.
Because we were on a
Question.
rail. Show me the rail that we were on.
But it's something that I've been meaning to ask you
Okay.
if you know an answer to it. This was back when the United Healthcare CEO got
that
killed.
whole thing, yes.
I had a slew of clients, and I also saw it on the news of people saying, well, I need to leave United Healthcare because they have the highest denial rates. Where did that come? Like, that
So,
was
yes,
total fake news,
That was
right?
total fake news.
Because
So-
I just kept saying, where are the numbers? Because my personal numbers
No.
show the opposite.
Yes, that is total fake news. The problem is with United Healthcare is that they are involved in so many areas. They do
Right.
group
They're,
insurance.
yes,
they
they're
do underage.
huge.
They did
Just by the
individual.
law of numbers, they probably
They're-
just
they're
have
huge.
more. I don't know.
No, and you're absolutely correct. I mean, like, again, when you're looking at the largest insurance companies in the both individual and group space, United Healthcare is king. I mean,
Yeah.
they are the giant to
Yeah.
beat, right? And so if you said, like, yeah, they probably would have, there's no numbers. I have no numbers to support this.
Right.
But when you're the biggest, you have more people, you'll have more denials, right?
Right.
But no,
But like
there's-
percentage-wise, there's no
percentage-wise,
way.
No, absolutely
Okay.
not. Absolutely not. Now, I mean, like, again, I know there's a lot of people that, again, I had them as underage. I had them
Yep.
when I was in my group. I had them as, as an ACA, I had UHC ACA plan. I was pissed off. I was frustrated. I got this denied.
Mm-hmm.
A lot of times when we see things that should be covered when they get denied, oftentimes it's done because the coding was incorrect on
Yep,
the provider
at the-
side.
on the
That's
provider side.
More times than not, that's
For
what
sure.
it is. But people don't know the difference.
Yeah.
Providers don't know the difference. When
Right.
you call and say, hey, do you guys take United Healthcare? They'll look down and they'll say, no, we don't take ACA. So no, we don't take United Healthcare. Like nobody knows.
They
So
don't know.
The problem is there's just like so much noise out there, so much incorrect noise out there. It does two things. It causes fear and it causes opportunity. You know what I mean?
I figured it did, but I was like, you know what? I keep saying all this stuff. I should probably like verify with somebody.
I don't have the numbers. I don't know the numbers. I don't know that, but I know I get this all the time with, I don't want that carrier. They didn't pay for this, that, or the other whenever I was in my 40s.
I'm chalking that one up to fake news.
Fake news. Yeah. Well,
tell me your updates
and again, guys,
of all your
if
meetings.
you guys have any questions or anything like that, please. I'm getting some text messages of like, oh, I see you guys. Thank you.
Finally, we're back.
If you guys do have any questions, anything that you guys need, again, this is just me and Kari just catching up and talking about what we have going on. So if you guys have any questions that you want answered, put it in the chat. This is my number. You can text me at any time. I'm reading them live, so just let me know. I've been busy. So the last 2 weeks.
You've been busy.
I've been on the road the last 2 weeks. A couple weeks ago, I was with Mutual of Omaha.
Okay.
And Mutual of Omaha is like the best at giving Medicare supplement updates because that's their field. They're in ancillary.
For sure.
They do cancer. They do long-term care.
It's their
They
bread
do
and butter.
annuity. They do a lot. But they have the best research and knowledge when it comes to Medicare supplements. And so I got some really good updates from them. So we actually, because of our production level, because of how large we are in the space, we get to sit on their advisory board, which is really cool. I really enjoy that. And so we were in Vegas, which I hate Vegas, but I love when Mutual of Omaha puts us up somewhere. It's the best. I had the most fun. And so couple things, again, a couple updates I want to give about Mutual of Omaha, but also just the MedSup space as well. They are very aware that the MedSup, obviously very aware. I will say like that, they are prepared to keep going strong with Medicare supplements, knowing that there really currently isn't an end in sight of these rate increases of this. That was a question I asked, like how much. I understand what they said. They were looking at loss ratios, and Mutual of Omaha, because of their size, does have some of the smallest. Mutual of Omaha and UHC. They gave UHC their roses while they were there. You know what I mean? They were very unbiased about like, this is the carriers, this is what they're doing. UHC and Mutual both have like some of the lowest loss ratios, which is how you can tell if someone's going to be able to stay in this business, saying that we have no end in sight of these headwinds coming. Okay. They said that for us to cover our losses, the average premium that a person needs to be paying on their Medicare supplement is about $2,000 a year. Right now, their average is between $1,600 and $1,800. Yeah. So there's a long wait. There is a significant, and that's what it is today. Today, that needs to be $2,000. Today, it's around $1,700. And the prices of medical equipment, everything's so expensive, right? So that $2,000 isn't going to be $2,000 next year. It's going to be even higher. $2,500. So the Medicare supplement is just kind of playing catch up to a goalpost that keeps moving, right? Yeah. And so they said because of that, there isn't really an end in sight.
So how did they for so long have why was it 2024 why did it all build up to 2024?
That's a really great question. Well, part of it was because there was with Medicare
why couldn't
supplement,
have been slower 6%, 7%, 8%, 9%, not 6%, 20.
Right. With Medicare supplement, there's a couple reasons for that. Some of them they told me, some of them is just me with my magic 8 ball and just trying to predicting it. So one of them is that Medicare supplements, because they were the king product for so long, it was a commodity product. It was a price. People, agents especially, I will take fault of it. I used to train on this. What price was the cheapest? A plan F is a plan S is a plan F. I'm going to put you with the cheapest company. So Medicare supplements wanted to be competitive in the space. It was nothing more than just who could be the cheapest.
The key.
Okay.
Yeah.
I'm so sorry. It got really scary. So
screens went black.
I'm sorry. So they were Sadie is having PTSD. So for so long, because it was a commodity product and the only differentiation was the rates. Right. And it was the popular product, so they had the loss ratios to support
it.
Right. So two other things happened. So that was one thing, that it was a race to the bottom when it comes to rates. Okay. Number 2. In 2017 and 2018, Medicare Part B changed to where joint replacements, such as the most popular ones, hip replacements, shoulder replacements
Yeah.
became outpatient procedures. That was in 2017 and 2018.
Oh.
That is now, instead of being covered under Medicare Part A, is now being
I didn't
covered
know
under
that.
Medicare Part B. And that meant that huge strain. And again, think about Medicare supplements. Medicare supplements after that, after the Part B deductibles.
Oh, yeah, they're covering 100%.
Covering, the 20% that Medicare
Right.
doesn't cover. So that put a huge strain on the Medicare supplement space in 2018 and 2017. And then
Why? What was the change in that?
I think just to save the
Why did they just to say Part A?
to save Part A, to save, the Medicare spending. Because again, with Medicare Part A, that is, after you hit that deductible, it's Medicare Part A covers it.
Right.
So they put it into an outpatient procedure so that some of that cost sharing would be on the beneficiaries
or the supplements.
and on the supplements. So that was a huge hit to them back in 17 and 18. And then again, COVID happened. What we're seeing now is, again, premium. It was a race to the bottom right now with med subs for rates. 2017, 2018, Part B started getting hit hard with these really expensive procedures.
Outpatient procedures.
And then number 3, we started seeing that people started selecting Medicare Advantage over Medicare supplements. And even worse, healthy people went to Medicare Advantage.
Right.
Sick people
went to
Medicare supplements.
Yeah.
So you had people who were,
Yep.
and at that time, because the baby boomer population is aging in,
Right.
they were waiting for these major procedures because of what the ACA did to group insurance. I'm nerding out. Stop me. if you
No,
want.
I am full on for everything
because
here.
what the ACA did to group insurance, which made it more expensive, made it less coverage,
Yep.
right? So those people are waiting to the holy grail of insurance, in their opinion,
To get everything done.
to get this done. So then
Yep.
you had people who were getting on a Medicare supplement when they turned 65, paying the lowest premiums because they're the youngest, having the most expensive procedures done. Once that was taken care of, jumping ship to go to a Medicare Advantage plan because now they were healthy. So the Medicare supplement for the last 10 years, 15 years, truly, since the standardization of plans in 2010 has been set up to have a really, and then
But they're not like gonna pull back. Like they're gonna still be around.
well, yes, so we'll get into that, and then we haven't even hit in the all the guarantee issue stuff that's happening this year, especially.
What is
Medicare
happening?
supplement had the most guarantee issue cases
Because of all the plans
because
leaving.
of all the SARs and because of the states coming in with these new
gosh.
birthday and anniversaries. It's a perfect storm.
It is.
I got excited. It's a perfect storm of why Medicare supplements are
Having rate increases.
So what
They
we
need
saw,
it. They need to.
when you're working with these companies that have huge books of business,
Mm-hmm.
I'm talking about the United Healthcares, even Humana, Mutual of Omaha especially.
Yeah.
The first Medicare supplement ever written was a Mutual of Omaha policy, right?
Yeah.
They have the resources to kind of go headfirst into the winds and survive. That's what these big companies, you're not going to see big moves. You're not going to see a
Right.
bunch of new paper. You're
Yep.
not going to see a bunch of new expansions. You're going to see survival mode for the near future while they try to figure out what does Medicare, because there is an after. There is
Yep.
a once those costs and premiums catch up, then we'll get back to single digit rate increases. But they got to survive that. So your smaller
Yeah.
carriers that do not have the book of business to support long-term loss ratios, you're going to continue to see those carriers coming out saying, like, we're out. We don't want to do this. We saw that with Lumico
Yep.
last year. Aflac has gone through some pretty tremendous rate increases.
Yep.
A lot of companies have said we're done working in states that have these anniversary rules.
What is the longevity of Cigna? Is
Okay.
what I want to know.
So we had Cigna. Great question. We actually had Cigna in our
They're
office
so low.
last year. And not last year, sorry, last week. And they were telling us that and I saw it. Mutual of Omaha showed us their loss ratios.
Cigna doesn't have any.
They do, but they're higher than what they would like, but
Yeah.
they're keeping up with the big guys. Cigna's a huge company.
Right.
But they're keeping up with the traditional, what you would think of Medicare supplements and whatnot. So Cigna is, and they're coming
Interesting.
out. They told us last week, now what they tell us is a sales organization, right? I can tell you what they told us. They're not seeing huge rate increases in their future. They're wanting to be really competitive in those birthday rule states. They're not having the headwind issues. The issues that they're having, though, are not corporate issues like loss ratios, actuaries. It's the customer service.
Yes.
And-
And their website.
Yes, I mean it's agent services.
Agent services.
They have put a lot of their resources into being able to keep a business alive and be competitive. Now they're having to figure out how to advocate those resources to actually selling the product. Is what it happens at the end of the day. So I don't see Cigna leaving the space anytime soon.
Good.
Right now, for a lot of
I've
people,
written a lot of Cigna.
for a lot of people, it's a necessary evil.
Yeah.
But they're very aware. When we were
Yeah.
in our office, we didn't hold any punches and just being like, you guys are. When you guys don't have the price, then you won't have the business. And they're
Yeah.
like, we're doing everything we can to correct
Well,
that.
and that's what like the last like anniversary changes, like GI changes I've done. I'm like, hey, listen, Cigna's the cheapest. You're gonna save $25 a month, but it might be a real big hurdle to get through this process. Like, do you want to do that?
Yeah. Yeah. And that sucks. Like, but that's what an advisor does, right?
Yeah,
An advisor
yeah.
is, do you want the
And that's
the
what they're
premium
like-
or do you want the
They're like, well, you'll be here to help me, right? And I'm like, yep,
Shit.
I will.
Yay.
Yay.
No, so that is another couple things I'll mention about the MedSet market is that Medicare, they're starting to see more of a shift to Plan N, not at the
Okay.
rate. You know, if you were here whenever Medicare Supplement Plan F was the Cadillac plan, and then people switched to G, that was
Yeah.
a much quicker rate.
Yep.
N for Mutual of Omaha makes about 20% of their business.
N does
N
20%,
does, which is high. It's higher. It's actually went up about 4 points
Yeah.
from the year before. Plan G is about 70%.
Okay.
And the rest of it's still Plan F.
still Plan F.
So, I mean, like, we are seeing a growth in N,
Yep.
but not at the rate that we saw G back 5 years ago. More than 5 years ago. Shit. I've been doing this for a while. 10 years ago.
10 years.
Not at the same rate we saw that about 10 years ago. So, as Plan G is a guarantee issue plan, as we see a bunch of those premiums continue to increase, Plan N is just going to continue to grow. It has to. It has to.
I need
for
to
your
grow
Medicare
N
supplement business
business.
to survive, you'll have to write
Yep.
in. Why don't you
Thank
write
you,
in?
Michelle, for
Oh,
that
Michelle,
information.
I can't see it.
She said United Healthcare sent an email with their denial statistics. It was the December 16th Jarvis Wrap email.
Oh my God, Michelle.
You are awesome.
Thank you.
Thank you. I don't know. I talk about ends, and I've definitely been talking about it more. I feel like I just don't have that many. Like when if someone wants a supplement, but G's too expensive, I talk about N, I talk about high deductible G, and I feel like more people pick a high deductible G than an N.
So interesting. I mean, that's cool. Again, I'm asking because, like,
So
I can read
and
the
that's
paper.
just my experience. Like
no.
I don't, you know,
I'm asking for your experience because I can read a spreadsheet all day and tell you over and over
Yep.
why N's the best option, but consumers aren't purchasing it. I don't get to be in front of the consumer and ask them why not. So it's very interesting.
Yep.
So that was one. Again, talking about Mutual of Omaha. And then last week, I got to do with another supplemental company. And it was actually, shout out for March being International Women's Month. I think last week was International Women's Saturday was International Women's Day, which is super exciting just for senior marketing specialist. Out of the 8 executive positions that we have, 6 of them are held by women, including our president.
That's
and vice
awesome.
president. So love that. That's a really cool.
Super cool.
Yeah. So we had a women's retreat for a company called Manhattan Life.
Yep.
Manhattan Life has been in the Medicare supplement space for years and years. They're actually they are one of the oldest insurance companies.
Really?
Period. They were writing claims in the Civil War.
I did not know that.
Yeah, it's a really, really I think they said 160 or 175 years of excellence. A really cool, and it's the vibe there. If I can use vibe in a professional sense, is that we actually met the owner.
Okay.
He came in. He graduated college, became an art dealer, and then wasn't making money dealing art. So there was I'll just invest in insurance and bought Manhattan Life.
There you go.
A really cool family atmosphere. These people were talking to each other
awesome.
like they loved each other. It was a really cool atmosphere. Manhattan Life is a Medicare
B rated, I believe, right? Are
Right.
they B minus or are they?
I think so.
I want to.
Because that matters for you with your financial planners. They have to be A+ rated, right? Well, I'll just give you a little bit of background on them. Not only were they a cool group to be with, and they hosted this women's retreat for us. Galen Hendricks, Queen of the Bundle, she actually was the person who kind of put this together for us. Where they're writing the most of their product is actually underage. They're calling it an ACA,
Okay.
not replacement, but an ACA alternative.
Oh,
So
yes.
where you group, like, there's
Yes.
about 3 products that you group together.
Super awesome.
And they
I
say,
know
like,
several like agents that have it.
I was going to say, we got
Yes.
invited to this trip because we wrote a bunch of it. I'm like, we did.
Yep.
And then I looked at it, and it was
Like,
you guys.
yes. Yeah.
Right? A lot
of
this
our team.
ACA alternative stuff.
Yeah.
And it was really cool. They were talking about some of the stuff there was wild to me.
It's very relatable to someone like us. Like you get
Yeah.
reimbursed for a doctor visit. You get reimbursed for like I don't even remember. Like an MRI, or you would get reimbursed. It's just like you're more everyday type. Not that you get an MRI every day. That
Right.
doesn't make sense. But it's
Yeah,
just not.
things
It's
that,
not
like,
like a
pop up.
catastrophic hip, like where it's
No.
just hospital. Like it's more of like the little things that pop up.
So
that
what
you have
she
coverage
was, she
for.
the person who sold a ton of it, she was talking to us about exactly how she does it, and she was
Uh-huh.
telling us that she was looking for ACA coverage or just marketplace coverage for
Yep.
her and her family. She was an insurance agent. She didn't have group insurance,
Mm-hmm.
so she was looking at that, and it was going to be her and her family was like $2,200 a month.
So expensive.
month.
Yes. Yep.
And so she got this for her family. And what she did is she found out. So she actually, some procedures that she had done for her son when she got off of her ACA coverage, she says, we're self-paying. We're self-funding this. We're paying ourselves. Because the provider wasn't turning in their claims. She was.
Uh-huh.
So then she got to negotiate cash. She was negotiating for those procedures that she received.
Uh-huh.
So her son was born with a hole in his heart. So every 3 months he had to go get an MRI. Is that what you do when you have a hole in his heart? And it was
don't know.
when she would get the evidence of coverage or the benefits
Yeah.
and things like that, she would end up having to pay, she said it was about $2,000 until she hit her max out of
Yeah.
pocket per visit.
Yeah. I believe it.
It went down to $500 when she was cash negotiating.
It's ridiculous. It's so backwards.
And it's because like the providers want to get as much money as they
Yep.
possibly can, so they
For
quote it at
sure.
a higher. When you're paying for it, they want their money. They know you're
Yep.
not going to pay that.
Yeah.
So it was $500 a visit, and she was able to pay for it out of pocket. And in some of these cases, when you're price negotiating, you're actually making money off your insurance because your claim, what you're filing, is actually more than what the price negotiated cost was.
That's
it
so
was
crazy.
It was interesting to me,
Yeah.
for me, who I work on the Medicare side, where
Right.
you're not getting the price negotiation. It's all done behind the scenes.
Yep.
The consumer's not really
That is
involved in the
cool.
claims. Talking about this product, I was like,
Yeah.
this is insane. And the real
yeah.
numbers of like what they charge in insurance and what insurance will charge you versus the price negotiated cost.
I know several people next door who have it.
Yeah.
Yeah.
Worth it. So if you
Yep.
haven't, and again, that was just for me. I always love it. I've been doing Medicare for 12 years.
Mm-hmm.
And I always love it where like I'm like I just something new, something fresh,
Yeah.
and I felt really reinvigorated.
Yes,
like,
it was
these
fresh.
really creative solutions
Yep.
to
I
problems
think they
we have
stop.
to healthcare.
They stop when you become eligible for Medicare, though,
Yes,
right?
yeah. Well, they don't. You can still purchase them, but they just
thought
don't make
they-
sense.
Right.
And they have a new hospital indemnity that I really like
Uh-huh.
that is designed for over 65 because the ambulance rider is included. And
Oh,
the
that's
commissions
nice.
are like 20% more commissions.
Wow.
I'm just saying. So it was interesting. I haven't seen a lot of that written compared to like a Wellaby or
Yeah.
a GTL or even an Aetna. So I've
Right.
not seen a ton of Manhattan Life hospital indemnity written. But the product did look really good.
Yep.
So that's
Super
what I've been
cool.
doing the last couple weeks is learning about Medicare
Just a little
supplements
bit.
and learning about ACA, not replacements. They were very clear. It's not a replacement, alternative.
Yep.
Learning about ACA alternatives and learning about, and I'll tell you what. So I'm sorry, I'm talking so much.
No, you're fine. I do have a 10:45 stop.
You have to go. Next
But
time.
we're good. No, we have
Next
2
time-
minutes.
No, you have 2 minutes. Get out
We
of here.
have 2 minutes.
Next time on the Medicare Cafe, we're going to be
We have
talking
2
about.
minutes.
What was I getting ready to say? I don't even know.
Michelle
next
said some more. What is the name of the Manhattan Life plan? I don't remember that.
oh my gosh, go Michelle, call us.
And tell me what makes you a proponent of the high deductible plans. I don't write a lot of them, Michelle. I do not. I maybe have like 7 of my like 500 clients that are high deductible, and all of them are they want a supplement. They want the benefits of a supplement plan of nationwide network, no prior authorizations. But if it's just too high for them,
They just anything to save the premium.
anything to save on the premiums. And all of them are people who have come off of an HSA. So they're used to a high deductible plan. They have savings. And so they're familiar with the structure and they're healthy. And,
That's a really good idea. An HSA to pay for that deductible. Because you can't use the HSA to pay for the meds at premium, but you can use it for the deductible.
Yeah. And so
what a great idea.
Those are typically the people, but I don't have a lot of them.
Guys, that's it for today. Thank you guys for handling us. I know this episode, even though we started late, I think was still even a longer episode because we've just been busy and we've been working.
Busy. Yeah.
And getting things done.
Busy's good.
Busy's good. Thank you guys so much for hanging out with us.
We'll be back next week together, right?
We'll be back next week. I'm so excited. And then you won't see us because we'll be in Hawaii.
We'll be in Hawaii together.
So sorry about you. Okay. Until next time, guys, have fun.
Make money.
And give impeccable service.